you can still become addicted to it. Most people think that because it's steroids, quote unquote, that
Mhm.
you aren't going to become addicted to it, but it's a drug, so you
Okay.
can. There are even treatment facilities for people who are addicted to steroids.
Hello, good evening. How are you?
Good evening. I'm good. How are you?
Pretty good, pretty good. What do you think of the show?
Great show. Love it.
Okay.
I
Okay.
especially love hearing the last guest, her
Mhm.
perspective. It's good
Okay.
to get the perspective of a woman, since most people don't. They assume that
Mhm.
women aren't doing steroids.
This is true. This is true. Especially since most are not trying to get big and muscular. They just want to look hot. Instagram hot, which is very doable. Like I said, some of the Instagram ladies, you think, I'll buy their special tea or their waist trainer or their whatever, and I'll look like them. No, you
Right, it's a lie.
got probably pretty good genetics, like say Ernestine. Obviously, she obviously has good genetics because just like the guy said, right? A lot of people take this stuff, they don't respond the same way. I'm very serious when I said I've met guys who, if you saw them on the street and they told you they don't go to the gym, you'd believe them. Guys were taking stuff. They just didn't respond that well to it. It is what it is. It's not some magic pill that you take it and you just poof. You look like Captain America or you look like Aquaman, Jason Momoa. You don't just look like these people because you start taking steroids. These people have elite genetics. They're very handsome or very pretty, etc., etc. So what do you think psychologically? What do you think about this kind of stuff as a therapist?
Well, it definitely changes your brain chemistry, which
Okay.
is why her boyfriend said that he felt like she was being masculine,
Okay.
because it causes you to become more irritable and anxious. So if
Okay.
you were someone who already suffered from anxiety, all it's going to do is heighten that. So anything is going to annoy you.
Aha.
You have to keep in mind that it's a drug. It's altering the chemistry in your body.
Okay.
And you can still become addicted to it. Most people think that because it's steroids, quote unquote, that you aren't going to become addicted to it, but it's a drug, so you can.
Okay.
There are even treatment facilities for people who are addicted to steroids.
Oh, wow. Never heard of that before. So it's like drug rehab, but for steroids.
Yes.
Wow. I did not. Yeah. I know sometimes when people for regular drugs, let's call regular sounds kind of strange, but where they go to rehab. So these people are obviously have a kind of addictive personality to some extent, which is why they're in a drug rehab program. But one of the things they like to do is get them to do exercises, right? Because that's good for a variety of reasons, physically, mentally, etc. One of the downsides potential can be when somebody like that, they get too much into the exercise and then they go from one drug to this kind of stuff. So they're substituting from whatever they were doing before, put them in rehab to this other kind of stuff. So I could easily see that occurring. And psychologically, if you look so fantastic, yeah, you'll probably be willing to do anything to stay looking fantastic. I remember this guy I saw in the gym. I remember he disappeared and I ran into him in another gym. Before this, the dude looked flawless. From his waist up, he just looked physically flawless. And then I saw him and he looked better than me still, right? But he didn't look like that super duper flawless and he would not make eye contact. And I've never seen him again. But I heard an interview with a guy who used to look incredible. And he said when he had problems with, I don't know if it was kidney or liver or something. And yeah, kidney, because he had to shrink his protein intake so drastically. He lost a lot of size. And he switched gyms. He started going to a gym that was like 20, 30 miles away because he said he's just too embarrassed to go back to that gym. He used to look that good, be that guy everybody looks up to compliment, ask questions. And he said he couldn't handle that. So yeah, mentally it can definitely be a thing. So for these steroid rehab programs, like what are they doing in there exactly?
I don't know the details specifically for the steroid treatment. I just know that they have them. From a professional standpoint, you're treating the addiction. They would treat it the way they would treat someone who's addicted to heroin.
I know psychologically this stuff is addictive. Are any of these steroids physically addictive? Like your body is needing it, so to speak? I've not been aware of that, but I don't know if you...
Not that I know of.
Yeah, I've never heard of that.
I wouldn't say that it's the body needing it. It's the person whose mind is telling them that they need it. Because the first step to fixing anything when you're going to see a therapist or going to a treatment facility is accepting that there is a problem. The fact that they're getting off or trying to wean themselves off means that they've accepted that they are addicted to said drug, and then that they are open to the treatment. And it's actually covered by your insurance.
Yeah, I would not have guessed that. Angelique brings up a very good point. Severe acne with steroid does not look pretty. I mean, how else other than addiction do one continue to use something that is literally destroying their most important organ, the skin? That's a very good point. The way Ernestine described it, she looked so fantastic that she's willing to put up with some of the acne for a while until she's like, this is too much. Because she said it was really, really bad. I didn't realize how bad it was till she said it was really, really bad, to the point touching it could hurt her. This is a good point because, again, you're putting up with this problem, but you look so fantastic. I can't imagine that, where you just look that good that you're like, God damn. You step into any place and everybody, male, female, is just like, wow, look at her, or wow, look at him. So that's got to be quite the ego trip.
And that's all the more reason why they keep doing it. It's ego. Pride comes before destruction. You have your ego, your id, and most people who are doing steroids, they want to look the Adonis Greek god. That's all ego. So they don't care about the side effects because I look like a Greek god.
Yeah, so Ernestine was very strong mentally for her to, switch, because I got to think that that's a difficult thing to do, which is probably why most people do not. As we were saying, this is a blessing in disguise that she had the back problem to stop. Obviously, she had to be very mentally strong, a lot of willpower to go from the baddest looking chick around to being, saying, nah, I'm not going to take that anymore. That'd have been extremely tempting, especially when she says, the 6-pack became a 4-pack, then a 2-pack. It's like you're seeing your stuff go down, down and down. It's got to be, the more I think about it, she's even more stronger than I realized. So I'm trying to imagine me losing muscles and thinking, God damn, if I only went back and taken this thing, my muscles would stay. That has to be so tempting to just keep going.
She had will and determination. Move away from this whole Black women have to be strong thing, because when you do that, we feel like we aren't able to be vulnerable because we always have to be strong. I did want to address the interactive metronome. So the gentleman who started it is deceased now. He was in a band. He started it so the band could all be on one accord. His name was Jim Casserly. The purpose of it, I keep saying it and typing it in the chat, but it's to build new neurological pathways. So it's an evidence-based training assessment tool. You have to do it with someone that is trained in IM, interactive metronome for short, which I am. And typically the people who are using it are therapists, school psychologists, neurologists, chiropractors, optometrists. Some teachers do it if they have a license as a clinical therapist. Physical therapists do it. But what it's doing is helping you make both the left and the right brain work together. And that's how you're creating the new neurological pathways. It's used for people who've had strokes. Athletes use it. Actually, the athletes at Notre Dame use it. Miami Heat uses it. There are quite a few. I know Baylor College of Medicine, they use it, but it's good for multiple things. So it's good for ADHD, kids who are on the spectrum, who have autism, sensory processing disorder, learning disabilities, developmental delays, speech issues, people who have cerebral palsy, auditory processing disorder. And for adults, it can be used for strokes. The gentleman who had the cardiac arrest, it could be used for him because that could be used for someone who has a brain injury. And since he went without oxygen for so long. But again, you have to do it with someone who is certified in IM. There's actually a website database. You can type it into Google and it comes up, and then all of the providers in your area.
I mean, it's going to be hard to know. I mean, you don't know this guy's diagnosis, but I guess when people suffer such traumatic injury, like what's the success rate for things like this, the metronome or other modalities? Do you know? I mean, percentage wise, I don't know, 10%, 80%, or just varies too much?
I've only used it because I'm not I'm a mental health, which is still in the medical field, but I've only used it on kids and adults who had ADHD or sensory processing disorders. But I do have several success stories of clients who were taking medication for ADHD. And one of the medications was like $350 a month, and that was with insurance. And after doing IM for roughly 3 months, the client didn't have to take the medication anymore. But IM is very expensive.
How expensive are we talking?
Each session is probably $150.
Is that with or without insurance?
Well, that's the thing. Depending on who's doing it, they may not take insurance. I know Health South is the #1 health provider, medical health provider that does it, but they mainly do it for adults who've had strokes, brain injuries, the spinal cord injuries. Typically, therapists like myself are doing it for ADHD and those other conditions. So it just depends on if that person does or does not take insurance. If you weigh the pros of not medicating your child, and then that medication is $350 that they would take for the rest of their life, opposed to $150 a session, and then you maintain that. Because once you've built the new neurological pathways and you don't have a brain injury, they're established. Because that's the problem. It's like the neurons in the brain are right next to each other. If you were to take your fingers and touch them together and then let them fall in between each other. That's what they look like when the neurons aren't touching.
Okay.
And so once you get them to touch, that's the creating the new neurological pathway. Unless something happens, that pathway is established.
Okay. Gotcha. Because you are determined to transform your body, you made it to the end of this video. To get more tips about how to look great and feel even better, check out one of these videos you see on the screen. I'm sure you'll enjoy them. So later's my massive. Me I go long now. For those who don't speak Jamaican patois, that's goodbye, my people.